Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. You know, congestive heart failure is a leading cause of hospital admissions in people over the age of 65. But the diet and the lifestyle practice you employ when you're younger largely determines if this serious life-threatening problem will develop as you get older. Now, as of 2012, about 4.3% of the North American population 65 to 70 years of age had congestive heart failure. But because the incidence is rising, even within that group of 65 to 70-year-olds, the estimate for 2030 is that 8.5% of people 65 to 70 years old will have congestive heart failure by 2030. So things are getting worse. There's been a rise in congestive heart failure in recent years. Clogging up your coronary arteries with cholesterol from having a poor diet is a leading cause of congestive heart failure. But there are other causes as well, like chronic obstructive pulmonary disease, emphysema, and the list goes on. One intriguing factor to me is that the body makes less L-carnitine and less coenzyme Q10 as we age, and studies show that when these supplements are given to patients that have congestive heart failure, very often their symptoms improve, meaning that their heart pump starts to get stronger again, which helps to actually reverse the condition. I've provided in the past a lot of updates on coenzyme Q10 and congestive heart failure, so you can easily search that under my name and you'll see the CoQ10 evidence. But what I haven't spoken about a lot is L-carnitine, which I'm going to do today. So the heart muscle and other tissues in the body rely on L-carnitine to transport fat into the energy factory of the cell called the mitochondria. Now the body normally makes L-carnitine, but as you get older, it makes less. Once inside the energy factory of the cell, or the mitochondria, natural processes occur that convert fat molecules into energy that the cell is going to use, and the heart is going to use that energy so it can pump and maintain normal pumping action. So L-carnitine transports the fat into the energy factory so it can be burned to make energy so the heart pump can actually work and stay strong. So a deficiency in L-carnitine, which is not uncommon in the aging process, sort of impedes the heart muscle's ability to generate optimal energy. As a result, the heart pump becomes weak, and when the heart pump is weak, fluids back up in the system, your lungs fill with fluid, your ankles start to swell, and other problems occur. As of 2024, there is no cure for congestive heart failure. Patients are given drugs to help manage it, but the 5-year survival rate is only about 50%. So in addition to a healthy diet and exercise, I recommend that individuals begin taking a supplement containing coenzyme Q10, hawthorn, L-carnitine, CoQ10, hawthorn, L-taurine, and quercetin by about age 45 to keep the heart muscle strong. These 4 nutrients have proven value in helping to optimize energy production in the heart muscle, and they support cardiovascular health in other ways. But studies show that in patients who are showing early signs of congestive heart failure, the further addition of 2 to 3 grams a day of L-carnitine supplementation may also be a wise thing to do. As reported in the summary paper found in the BMC Cardiovascular Disorders in 2014, L-carnitine supplementation has improved many cases of congestive heart failure. This supplement has been shown to increase energy production in the heart muscle, re-strengthening the heart pumping action. It also shows other benefits. The researchers cited an important systematic review paper showing that L-carnitine administration was associated with a significant reduction in all-cause mortality, ventricular arrhythmias, and angina in the setting of acute myocardial infarction. In other words, in people that have had heart attacks. So keep L-carnitine in mind, as it may benefit you one day. Certainly around age 45, I believe it's a good idea to support your heart's pumping mechanism by taking a supplement each day that provides CoQ10, hawthorn, L-taurine, and quercetin. L-carnitine is a further consideration for some people. So I've included the references for congestive heart failure and L-carnitine in the text below. Thanks for watching, and I'll see you next time.